Welcome back to The Explainer. Today, we're tracking a really rapidly evolving and, frankly, deeply concerning situation over in the Democratic Republic of Congo, a brand new Ebola outbreak. We're going to map out the whole thing, what's actually happening on the ground, the specific strain we're dealing with, and the global ripple effect. Okay, let's dive into this, because the reality on the ground is moving incredibly fast, and it is absolutely devastating.
Before we even get into the data or the logistics, we really need to ground ourselves in the human cost of this. Listen to what Jean-Marc Asimwe, a resident living right in Bunya in the Ituri province, is experiencing. He said, every day people are dying. In a single day, we bury 2, 3, or even more people. You know, it's not just a distant statistic on a page. This is a daily, terrifying reality for people living right at the epicenter of this crisis.
And that awful reality, it's totally reflected in the official numbers. We're looking at 80 lives lost so far, with 246 suspected cases. For a completely new outbreak, those numbers are climbing fast, like really fast. It just goes to show the massive impact this virus is already having on the local population.
So, to really grasp how quickly things went sideways, let's look at the timeline. Back on April 24th, we get the suspected index case, a nurse in Bunya who had symptoms that looked a whole lot like Ebola. Fast forward just a few weeks to May 14th, and an infected patient tragically dies, but this time across the border in Kampala, Uganda. 2 days later, May 16th, the World Health Organization steps in and officially declares a public health emergency. Talk about a rapid escalation, right? From one single suspected case to global alarm in a matter of weeks.
Now, you might be wondering, what exactly does a public health emergency of international concern actually mean? Well, it's basically the WHO's way of flagging an extraordinary event that poses a huge public health risk to other nations because it could spread internationally. But, and this is a really important distinction, the WHO was super clear that this currently falls short of a full-blown pandemic emergency. So yes, it's a very serious international emergency, but we are not in pandemic territory right now.
Section 1. The rare Bundibugyo strain, a unique threat.
Let's look at the science driving this crisis. Tests confirmed this is the Bundibugyo virus, which officially makes this Congo's 17th Ebola outbreak since 1976. And just like other Ebola strains, it is highly contagious. It spreads through bodily fluids like blood or vomit. It's rare, it's incredibly severe, and it's often fatal. So the crucial point is this. Right now, there are 0 approved vaccines or treatments for this specific strain. Nothing. And that's exactly why medical professionals are basically racing against the clock.
To put this into perspective, look at the historical context, because it shows us exactly why this specific outbreak is setting off so many alarm bells. The Bundibugyo viruses literally only caused 2 previous outbreaks in all of recorded history. Back in 2007 in Uganda, there were 55 cases. In Congo in 2012, 57 cases. But today, we're already looking at 246 suspected cases. You can instantly see why experts are so incredibly worried. This strain is behaving way differently and spreading way faster than it ever has before.
Section 2. Regional spread and logistics, the containment challenge.
Okay, beyond the virus itself, the people trying to stop this on the ground are facing a literal uphill battle. Think about the geography for a second. The outbreak epicenter in Ituri province is 620 miles away from Congo's capital, Kinshasa. 620 miles! That is roughly the distance from New York to Detroit. Congo is the second largest country in Africa, so just imagine the sheer logistical nightmare of trying to deliver medical experts and critical supplies across that kind of terrain. It's staggering.
But unfortunately, distance is just one piece of the puzzle. And this brilliantly illustrates the incredibly complex real-world challenges of managing an outbreak. Responders aren't just fighting a virus. They're dealing with active, severe violence from Islamic State-backed militants in the Ituri region. Then add in populations constantly moving back and forth from places like South Sudan to Uganda. Oh, and on top of all that, a massive lack of basic testing supplies. It's essentially a perfect storm that's actively sabotaging every single containment effort.
Just to give you an idea of how bad the testing situation is, check out the numbers from the National Institute of Biomedical Research. Out of a crisis involving hundreds of suspected cases, they've only been able to process 13 blood samples. 13! 8 of those came back positive for the Bundibugyo strain. But get this, 5 couldn't even be analyzed because they literally didn't have enough sample volume. So responders are out there trying to stop a deadly virus, and they are practically fighting blindfolded in these crucial early days.
And because people are constantly on the move, like we just talked about, the virus has already slipped across international borders into neighboring Uganda. The psychological toll there is just heavy. I mean, listen to Ismail Kagongo, a resident over in Kampala. He said, "I really get scared because I remember burying my father without looking at his body. The trauma of the COVID-19 pandemic is still so raw for so many people. The thought of another deadly virus going around, it carries a massive, terrifying weight for local communities." So how are Congo's neighbors actually handling this? Well, Uganda had that one confirmed imported case that sadly resulted in a death at a Kampala hospital. The patient's body was sent back to Congo, and thankfully no other local cases have popped up there yet. Meanwhile, over in Kenya, they've assessed a moderate risk of importation just from regional travel, so they are not taking any chances. They've spun up a preparedness team and are seriously beefing up surveillance at every single point of entry. Basically, the whole region is on high alert.
Section 3. U.S. Readiness and Response. The Global Ripple. Now you might be asking, where does the United States fit into a localized outbreak in Central Africa? Historically, the U.S. has actually been the absolute biggest external player when it comes to jumping in and fighting Ebola outbreaks, but there are concerns right now. Dr. Craig Spencer, he's an ER doc, public health professor, and an Ebola survivor himself, he put it like this: before the second Trump administration, USAID would have been on the ground. The CDC would have been on the ground at a moment's notice because we were in a bunch of countries. We created relationships beforehand. He's pointing out a pretty massive shift in how America responds globally. To see exactly what Dr. Spencer means, we just have to look at some specific policy shifts experts are highlighting. These include cuts to the U.S. Agency for International Development, the U.S. withdrawal from the World Health Organization, and a bunch of empty seats in the Office of Pandemic Preparedness and Response. A lot of experts suggest these exact structural changes might explain why this latest outbreak wasn't officially announced until a Friday, which kind of slows down how fast the whole international community can rally and react. Let's move to and see how this builds our understanding of where the U.S. stands right now. It's basically a tale of two capacities. On the global side, you've got these real concerns about a sluggish overseas response because of those agency cuts and missing personnel we just talked about. But domestically, it's a totally different story. Dr. Spencer himself is super clear that the U.S. has incredibly strong infrastructure set up for treating high-consequence pathogens right here at home.
Yeah, the U.S. is actually really prepared domestically. We maintain a dedicated national quarantine unit in Nebraska, plus over a dozen specialized centers all around the country. These places were built precisely for exactly this, handling crazy pathogens like Ebola and hantavirus. Plus, as Dr. Spencer reminds us, Ebola actually isn't that great at spreading globally compared to airborne viruses. So thanks to all the huge investments made after the outbreaks a decade ago, the U.S. is highly capable of dealing with this if it ever reaches our shores.
Which brings us to the final thought for today's explainer. In a world of highly contagious pathogens, is a localized response ever enough? We literally just saw how fast a virus can jump from a single nurse in Butinyana to crossing international borders, and how things like extremely limited testing and regional conflicts can totally hide the truth of what's really happening. As the world's readiness shifts and changes, we really have to ask ourselves, just how interconnected is our global health security? It's something to think about as you follow the news on this outbreak. Thanks so much for joining me on The Explainer, and as always, keep learning.